Hello, everyone, and welcome to our Ask TLC show. We are very fortunate today to have Jackie Cashman with us, speaking about concerns with medication use and alcohol use. And Jackie is a licensed clinical social worker and an RN. She has an extensive background in this topic, and we are very pleased to have her with us today. So Jackie, I'll turn it over to you.
Okay, welcome. There's probably many reasons why people would sign up for this presentation. Maybe they're interested in educating themselves. Maybe they're concerned about someone else's use of alcohol or drugs. Or maybe there's a part that is concerned about your use, whether it's normal. People take drugs and use alcohol for many reasons: to feel good, to relax, to cope with stress and anxiety, depression, emotional pain, trauma, to stay awake or go to sleep, or to be sociable. Are any of these valid? Statistics in a community dwelling setting of people between the ages of 60 and 94, 50% drink alcohol of some type and more likely do it 20 or more days a month. 50% of people 57 to 85 take more than 5 medications or supplement drugs daily. Prescription drug abuse is when people misuse prescribed medications, and I'm going to use the word meds instead of medications for each time. Prescription drug abuse is when people misuse meds. They may abuse their own meds in a way that was not intended by their physician. This may include taking more meds than they need, or taking medications whether they need it or not, because in their mind, well, gee, maybe I should take a little bit more. Or they may take someone else's medications. I don't know about you, but I've had the experience where I've been out with people and someone will mention something about, well, I have this pain or I have this headache, and somebody will reach in their pocketbook and take out a little miniature pharmacy and say, oh, can I give you some of this? And then the other person, oh, yeah, I'll take it. That's not okay. This practice leads to serious problems, such as drug interaction or overdose. A drug interaction is when 2 or more drugs react with each other, either canceling each other out, making the drugs less effective, or possibly causing harmful side effects. An abuse of meds is not just with prescription. Over-the-counter meds are also abused. The older we get, the more likely to experience more problems with very little small amounts of medications, because the older we get, the less we're tolerating a lot of these. So we can develop the sensitivity, as well as we have problems with slower metabolism and elimination. And this is also true when it comes to alcohol, and I'll explain that later on. Older people generally have more problems, including pain, anxiety, depression. And with these symptoms or these issues, your doctor may prescribe certain medications, especially if it has to do with pain. They may prescribe analgesics such as Tylenol 3, hydrocodone, or Percodan. If you have anxiety or sleep problems, depression, common drugs for those would be Xanax, Ativan, and Valium and Librium. And many of these drugs are easily abused. Again, the idea, well, I took it yesterday and, well, I didn't feel exactly great. Let me take 2 and see what happens. When you visit your doctor, there's a couple of things that are very important to remember. Number one, your doctor should have a complete list of all of your medications, which he has prescribed, and the over-the-counter medications that you are taking. It's also very important not to be jumping around to different pharmacists, because your file with one pharmacist has everything on it. There's no connection if you're doing Walgreens, CVS, or any of the others. And so therefore, when a doctor gives you a script and you take it to the pharmacy, if they don't have your record, it's not going to be able to pop up that there's something wrong there. There's an interaction that's going to happen, or this is not the right medication for with this consistent with the drugs that you're taking. And the thing is that you're responsible for your own health. And so when the doctor gives you a medication and you're in the office, don't let him rush out. You want to find out, what's the name of this medication? What does it do? What should I look for? He's not always going to give you the whole list of things, but just to give you some ideas. It's important. Remember, you're in charge of your own health. Ignorance is not okay. Alcohol abuse or problem drinking occurs when our use creates a negative consequence that results in harms to one's health, relationships, or their ability to work. Abuse drinking is more than the safe guidelines recommend. Now, 2 drinks or less for a man per day. Oh boy. And for women, 1 drink a day. Those are the recommended guidelines. And wine doesn't get a pass on this. Wine also has recommendations that a man can have 2 5-ounces of wine a day and a woman 1 5-ounce of wine a day. And it's pretty obvious why there's a difference in the amount we consume is because of our bodies, our shapes, our sizes. How does alcohol, the abuse of it, affect us essentially among our senior citizens? First, it affects the brain and the structure and function, which can lead to a decline in cognitive ability. That's your thinking process. And it can also damage your memory. Drinking too much over time can lead to some types of cancer, liver damage, diabetes, high blood pressure, and other physical problems. I mentioned earlier about metabolizing and elimination of drugs in our bodies. This also applies to alcohol. Our liver regulates our chemical levels in the blood. It cleans our blood by removing these toxins and wastes, which in this case, I'm talking about drugs and alcohol. We process 1 ounce of alcohol per hour. Okay. So breaking down of these toxins decreases with age. So again, like everything else, our bodies start to slow down, resulting in these toxins remaining in our systems longer than we should. And this affects us greater with age because our muscle mass has been replaced with fat tissue. When the liver is overworked processing this alcohol, these drugs, what happens is the other products that are floating around in our bloodstream can't get processed, can't get cleaned out. And so they remain in our bloodstream. Very often, that's why you're going to get a high blood sugar if you take a blood sugar test, just like if you were diabetic. So I'm not saying we need to give up wine or alcohol if we do it responsibly. Now that I've given you a lot of that information, which you probably are going to forget, I'd like to talk about why you were interested in this topic. If your reason was for yourself, you might want to notice your drinking pattern. When do you start? How often during the week that you drink? If you haven't done this already, there's a little voice in us that says, I don't know if I should take that. Maybe 1 more won't hurt. Has anyone commented on your drinking? Have you been around at a party and someone kind of mentions, gee, you really like that daiquiri. You've had a couple of those already. Okay, keep your ears open. Have you tried to cut down and maybe been successful for a short period of time, but that doesn't last too long because you're back drinking again? There are things that you can do for help. And I'll talk about that in a moment. If it's for your loved one, you have probably tried a lot of things to get them to stop drinking, and it hasn't worked. You can try all you might, but it's not going to work. They have to be wanting to stop themselves. You can only control your own life. Many times, our attempts to control someone else's drinking only makes the situation work. And again, if somebody has an alcohol problem and you keep nagging them back, they don't need a lot of excuses to drink again. A broken shoelace, oh, I better take a drink. Whether the concerns for yourself or others, I would recommend suggestion to visit an AA meeting, an open AA meeting. And the reason I suggest this is that very often, if you go to an open meeting, which means the people in that meeting realize there are guests in the audience. And if they're still willing to share their stories or their pain, whatever, they're going to do it. Okay, so there's closed meetings and open meetings. Open meetings, the one you want to go to. And I always recommend people to go to an open AA meeting so they can really hear what the problem and the suffering that these people have with this disease. And the stories are amazing, that the trials and tribulations they've gone through. But because they're there in AA and they've been working on themselves, they've been able to get help. And that's really the only way you're going to get it. No one else can do it for you. Also, another suggestion might be to go to an Al-Anon meeting, because in an Al-Anon meeting, you can get some ideas of things that have worked for other people in relation to their significant other or loved one that has this disease. So those are things that you can do, and even to help yourself. Going to an open AA meeting, you might hear something that kind of resonates with what's going on in your mind and the questions you have about your own use or the use of someone that you love. Going to an Al-Anon meeting can kind of help. In Al-Anon meetings, they're open. You don't have to worry about that. Al-Anon meetings, you're going to hear from other people who are living very comfortably with a person that is still suffering from the disease, but they have found a way to get that peace of mind for themselves. And if you're looking for a list of places to go for AA or Al-Anon, the Sun newspaper once a week has a whole listing of all the different places that have Al-Anon, AA. One of the things I would caution someone about is they have meetings for adult children of alcoholics. Claudia Black started that movement many, many years ago. And the one thing you have to be careful about is if you go to some of these meetings, the leaders are not really that well trained, and it can create more anxiety for you going to something like that. So, try to stay away from that. Remember your open AA meeting and your Al-Anon meeting. Also, if you belong to a church, very often they have in their bulletin every week the things that are going on in their church or their synagogue, and they have listings of AA and Al-Anon and all the others. So I would encourage you that if nothing else, if you have a question at all about this disease, visit these places, get some knowledge about it. And going back to your medications, remember what I said, ignorance is not okay for you. You need to be responsible for what you're taking into your body, because it's your body. And going to a doctor and making sure your medications are aligned with your over-the-counter, your OTC medications, is going to be a great help for you. And now I'm going to send it back to Bonnie, and have any questions you can ask, and I'll try to answer them.